Hey everybody, I'm Jonathan, and I'm here today on behalf of Integrative Bodywork and my bodywork partner, Alex Sussbauer. We spend a lot of time getting you technique videos and showing you as therapists how to address some of your client issues, but one of the things we feel is so important is self-care. We do not have enough time, both as therapists who need it and some helpful stuff for our clients to do in between sessions. Money, time, all these things challenge us from really getting to where we want to be on this massage table. So today we're going to look at some self-care ideas, and I'm going to run you through some stuff that's basically mostly for the upper body, the relationship of the pecs and the ribs, and some really nice slow breathing compression with the foam roller. Okay, so before I begin showing you all these ideas and techniques and concepts, what I'd really like to make sure you know is that even though I'm going to play them out in a certain order in this video, they don't necessarily have to be this way. And to be honest with you, on certain days, depending on what I feel like my body needs, I dance a little bit from technique to technique and maybe even come back a second or third time to something, knowing that I fully have made change and gotten what we think is most important, integration for our entire system. All right, let's talk about these quadriceps, folks. We got 4 big giant muscles in these legs, and remember the 2 of them originate on the back side and wrap around. And for me, I am constantly dealing with tension in my quads, and my left TFL has been the bane of my existence for at least the last 10 years. So I'm going to talk about this first with the foam roller, and then I'm going to talk about it with this little lacrosse ball. It may look all friendly and nice, but man, the surface area and specificity that you can get with this doesn't take a lot of pressure. So if you see tears streaming from my eye amidst this little section of the video, don't be surprised. I like to use the foam rollers, the warm up here first, so I'm just going to get myself on. And since I'm facing the camera, I think I'm going to choose my right leg here. And I like to get right at the top of the hip. And again, I'm using my right arm for some balance, but I barely need it. I don't feel like any of this is too much pressure at all right now. And I'm going to roll just a little bit forward. Oh yeah. And there's my right TFL. Good. And now I'm going to stay kind of lateral because I can feel that tension line. So I'm slowly, again, rolling through. But the speed and pace that I bring to the movement is minimal. And I stop along the way where I feel these places where... let's just call them pockets of delightful tension. Yeah, and I can already feel I need to get a little more onto the anterior. So I'm bringing my left leg down to the ground to support me. I'm going to splay out over this foam roller. Oh boy, I'm going to breathe. Yeah, because this is what I was sensing just about 30 seconds ago, lowering my leg. I'll be honest with you, for me right now, I feel like I'm maybe, I feel like I'm really maybe in between rectus femoris and vastus lateralis. That's not to say that I have enough compression to get all the way down into vastus intermedius yet, but there. I don't think it's one versus the other here. I'm definitely working a bit of both. Now, I'm just going to make a suggestion here to really be mindful, because the line between too much pressure and not enough pressure in any given moment can be a very fine line. So try not to contract your leg. Try to focus on relaxing it and letting that compression get into the tissue. And once you, again, feel like you've gotten somewhere, you can slowly move on. And again, folks, listen, these are big muscles. You can spend easily 10 minutes
in a side. It really depends on the day. I tend to be in these muscles in particular, gosh, at least 4 or 5 days a week for about 5 to 10 minutes. Some days I'm in here in the mornings. That is the spot. Oof. Some days I'm in here at night. It really just depends, but I can't tell you enough. For me, my personal need is to make sure that the quads have more freedom. So think about the foam roller here as the warm-up for what's about to happen next. Because as I come off that foam roller, I am going to get in with this. And again, it looks real innocent. Fun little toy. Yay! But no, it's not. It's an amazing tool because the specificity that I can get in the leg, or really almost anywhere, happens instantly. I'm backing my left leg up because the weight of my right leg alone is more than enough. And if I really feel like, and I don't right now, but for all of you at home, if I feel like I need more pressure here, all I have to do is roll my upper body. My pelvis starts to rotate a bit with it. And I can feel myself coming on down in. And I put that lacrosse ball right where I left off with the foam roller, where you heard me saying, oh, that's the spot. That again is the spot. You can bring the other leg over the top of it. Yeah, I don't need that. It's too much for me. I could feel it almost as I brought my leg over. The sustained pressure, the meaningful breath, the ability to start, to move deeper and more significantly into the area that just needs the release. Oh, there we go. It must have heard me. Oh, boy, that feels better already. I think you can all even hear it in my voice. The whole tone of my voice just changed. That's how significant this is for me. I know other people have problem areas, and so if you think about this for yourselves and you see some of our other self-care videos and you know that these other areas are your spots, I still urge you to take a look at how I'm managing this and really knowing that it's your experience that matters. And so pay attention because, boy, I can't tell you how much in the last minute what's changed right under where this lacrosse ball is making contact. And I'd say at least a double radius outside of it. Boy, that was really significant. I feel better as a human being even before I get up off the floor. So that's it. I mean, I just want to urge you again to be really careful and slow here. It's one thing to think that you can mash things out with the foam roller, but I'm telling you, you get even the slightest bit aggressive with this little tool, not only are you going to be miserable, but you could damage some tissue, you could hurt yourself, you could make things worse. So you should be slow and cautious and careful here, okay? Okay, so I've made my way to the floor here, and you can see that I've got the foam roller just waiting for me. But still, just a couple more things here. First and foremost, just like we tell our clients, you are the one in control here. Too much is always too much. Listen to your body, breathe. This is a self-care tool. It is not a torture device, okay? So first, I'm going to take a look at my serratus, and let's really just think about it as the lateral rib cage. As I bring myself on down to the foam roller, I'm just making contact, seeing what my pressure feels like with some body weight. My right hand here is doing some regulating of that. I definitely feel like I can use a little more pressure, so I ease my arm out and I come on down and I breathe. Man. It's great to do a video like this because the truth is I need this. As soon as I'm in, I realize that this video, though is for all of you, what I'm doing is really for myself. And I think that's the feeling that you should have
as you start to get in and do some work, you're aware, yeah, oof. You have the ability to move. I'm just rolling my rib cage. I'm finding more breath. I'm rolling towards you a little bit. It might be hard to see on the camera, so I'm rotating my head down towards the floor to show you which way I'm going. Man, I have found something good. So I'm just gonna move my hips. Yeah, there we go. A lot of staying in place. I think people hear the word roller and think we're pizza dough and then we have to mash ourselves into submission. It's not what we're doing. Okay, I've got a lateral side of my rib cage, so I'm gonna flip on over and turn my back to you here because I wanna get some time with that too. And it's the same principles here. I'm just gonna talk less since my back is to you, but it's the same. Oh, yeah. Remember supporting yourself with your arm that's down on the floor. There we go. Oofa. Yeah. Good. Okay. So, now I've gotten the lateral rib cage in here. I'm going to get into the back side of this a bit. And what I want you to be thinking about, again, is not so much the compression in the back with the foam roller itself, but how much I can open myself up over the arc. Again, continue to breathe. Pay attention to the sensations that you're feeling. And I want to throw you a little cue here because I can almost feel this myself. I don't feel completely situated where I need to be. So instead of getting up off the foam roller, I'm just going to close myself up for a moment. Yeah. And I can get a little scooch underneath there so much more easily. And I can open. You think this is for the video, but you'd be surprised at how much that little micro movement just made a difference. Especially for whatever reason in my right arm right now, or really my right pec. I can feel so much more of that in off the body of pec major at the sternum. So again, try to remember to think about this as less about, oh, I need a bunch of compression in my back, so much as this is arcing and lifting over the foam roller and almost rising up out of that position. Okay, folks, I'm going to bring you a slight variation to what's a traditional cat-cow. And really the difference is in the breath pattern. A lot of times, especially in my own yoga practice, it's all about focused and slowing down that breathing. I'm actually going to stop and hold my breath in position to allow for greater expansion of my rib cage in this process. The first time, I'll cue you up with all the verbalization of what I'm doing. The second time, though, I'm just going to run it through quiet so you can see it on your own. All right, so I like to get myself real established in terms of that sort of middle position. I also try to maybe just think about what my hips are doing here. Good first breath. So as I come into cat, I do again, think about the movement in my rib cage. Try not to, it's really easy to drop your arms out from under you. That puts a lot of strain in your neck. Try to stay pretty straight with it. And then move in to arcing that back into full cat position. Now here,
I am going to take a big breath. And I have held that breath for a good 4 or 5 seconds. So I'm going to drop back into cow slowly. Again, trying to keep my arms supported. And now this time without any cue. On the exhale, I come out and back into cow. I think one of the advantages of doing it this way is really allowing your rib cage just to stay in that fuller position for longer. I completely understand how holding your breath seems a little counterintuitive and feels like we're engaging the sympathetic nervous system rather than the parasympathetic nervous system. But I am trying to get a physical result out of this more so than a nervous system result. All right, folks, here's another little variation on a very familiar yoga pose. I'm gonna do some child's pose, but I'm really gonna bring it back into the sides of the rib cage and to give us some more expansion and room laterally in here, I'm gonna move from side to side as I actually find my way into child's pose. Okay, so find traditional child's pose first. And I oftentimes, I'll spend just a little time here before I go for the bigger stretch, just to kind of see where my body's setting, especially in this process that we're mapping out for you today. Once I feel like I'm good, I gotta get my hips, there we go, that's a little better. I'm gonna start with the right side. I'm gonna reach across and find length through the side body here. Presently, I'm resting my head on my other forearm, makes it real nice and soft. And just like we did cat-cow, I'm gonna work to find some breath. And what's really interesting in my first breath is I've got a lot of room in the side, but not much room in my back. So I'm gonna try to find this again. That's better. Good. Now, if you really would like to take this up just a notch, you can reach just a little further with your right hand and you can start to shift your body over. Oh my goodness, yes, over into that lateral body with the left arm. I'm directing myself to the right by pulling through the left. Boy, that breath in there needs to get some rib movement happening. I mean, I can dial in and really feel it around 6 or 7 for me. Okay, slowly come back, and I'm going to do the same thing for the left side, but I can tell you all without even getting into this, it's going to feel different, but I want to start in the same way. I really just want to relax into the same pose. Oh, find some breath. Yeah, it's clearly going to be different. But in order to open up that left side more, again, if I just draw through my right arm, I'm leaning into the left. I feel a much greater pull of the stretch all the way through almost the lat line and the ribs. And boy, my breath really is filling up this side, but good. And then whenever you feel ready, you can come on back. Just a traditional child's pose. And I would say here for sure, you can come back to either side. If you feel imbalanced now that you're centered again, really listen to that. If you feel like you need a little more time in the right, spend a little more time in the right. If you feel like you need a little more time in the left, then spend a little more time in the left. But always come back into the center position to recognize change and balance.
I'd like to show you a couple variations of some stretches in here, and I'm going to move through them, not necessarily in an order that I would do them, again, on my own, but so that you can see some differentiation and some importance to why I'm doing a couple of different variations, even though my focus is still up in the pecs. A couple of different ways to do this always, I think, makes a really big difference. I know it does for me, to be honest with you. I am going to start with the 90-90 here, and you can see this is anybody's doorway, okay? Doesn't really matter as long as you can get yourself in it properly. My elbow is up against the wall here, and I'm going to step through first to start to find that pull here. And take a breath. I should be able to breathe comfortably. You should be able to breathe comfortably. And as long as that's happening, then I can start to rotate away to the left. Now, one of the reasons that I'm actually starting with the single arm stretch here instead of the double is because I'm going to give myself the opportunity to know what the differences are from side to side. Boy, that feels really good right now, I gotta tell you. Now, I'd like to get a little more bicep in here, so I'm gonna straighten out my arm. I'm still in the door frame, but I'm doing the same thing. The stretch is still coming off pec, but it's finding its way down my arm beautifully right now. I can still breathe comfortably. And when I feel like I'd like a little more, again, I'm stretching out the right side, so I'm turning to the left. Yeah, I found something in that medial head of bicep right there. Good. Okay, I'm just going to give you a quick view from the back for the left side here so that you can see where my elbow was, where my arm is. Nothing's really going to change other than the side. I'm stepping through. Yeah, that's better. I had to really adjust myself there. There's my big breath, and now I can start to rotate out towards the right side. Yeah, I am really such a fan of doing the single arm stretch first. Much like you heard me talking on the floor about the difference in my rib cage from the right to the left, I have a very, similar patterning going on up in my pecs. And again, now you can really see how my arm, I got to step in a little more here. There, and this is the bicep variation. Again, I'm still getting a good stretch off pec, but there's so much less in my left bicep, which will make this interesting when I move into what's now going to be the double stretch. Sides, sides. I like to not only step through, but my back leg pushes through the gastroc a bit. And when I really start to feel it, I ease my hips back and get a little bit of tilt here. Boy, does that bring that into the pecs. Man, and what I really like about the double usage is that I can kind of feel my scapula is releasing off the rib cage a little bit as well. And when I'm in the door, if you prefer the double stretch, you can still do some rotating to the left to accentuate the right. You can still rotate to the right to accentuate the left. I got one more for you here though. Close that door. The door handle is what I'm going to use next to get low Boy, I just felt a little cavitation in my shoulder. I love these videos because they're happening in the moment. I am again stepping through, and what this does, this really gets up in this clavicular division. It's really the same thing. I'm drawing myself forward towards you, and then I begin to turn to the opposite side. And here, boy, can I feel that. Looks similar to the biceps variation, but I'm telling you, if you're doing it correctly, you'll feel it along the clavicle instead of out here in the sternocostal division. And again, easy enough to just move into the left side. Step through. I'm going to give my left side a minute here because I can already, it's so interesting the differences in the two. Yeah, pec majors, boy, it really is. I don't need much rotation to the right at all here, folks. I'm really feeling that. Great. So again, doesn't have to be in that order. I really like the ability to play from side to side. We have dominant, non-dominant sides. There may also be some other issues in terms of some of the things that we've done here that may create or make it feel like it's different from side to side. I really want you to pay attention to those nuances, okay? All right, that is a bunch of great ideas for your upper body, for your pec majors, for opening up the anterior aspect of your body. And I gotta tell you all again, we talk about it in body work, that oftentimes it's this closed down front area that creates a bunch of tension in the back side of you. So if you're feeling like your rhomboids are screaming at you or your ribs are just locked up in the back, really this is such a great way to exercise your own control over some self-care, opening this up and relieving some of that tension. Before I go though, I want to remind you, listen to your body. We are not looking to create pain. We're not trying to tear anything open. When I'm on the foam roller, I'm not trying to smash anything into submission. We want you to be as careful as possible with this when you use it on your own. We're not physical therapists. We're not chiropractors. We're just body workers who are trying to make some very helpful suggestions for you to take care of yourself and maybe some ideas to pass along to your clients in between their sessions. Listen, I just really want to thank you for paying attention to this video and for the time that you invested today. I want to remind you that we're integrative bodywork for the manual therapist. So if you like this video, feel free to subscribe, and you can also check out a bunch of other stuff that we've got at our website, including other videos for techniques, as well as textbooks and other helpful information. I'm Jonathan. Thanks a lot.
We hope that you found this self-care video helpful. If you enjoyed it, please like and subscribe and all that good stuff. And also check out our website at integrationnationbodywork.com. Thanks for watching.